talking today about increasing health insurance for firefighters. When firefighters run a call, they risk more than their own life to selflessly serve others. In some states, with good health care for firefighters, there is still loopholes and shortcomings, such as a firefighter being thrown off a building if he wasn't wearing his gloves would not be covered by good health insurance in most states. That is because of OSHA. Firefighters develop many health issues which include physical, mental, and emotional risk. They put their lives on the line every day in traumatic events and carcinogenic environments where they do not earn enough to keep their family functioning or pay for their expenses if they were to get sick. Many times firefighters cannot afford their own family. Firefighter John Lawyer stated, "It's a very difficult thing to walk away from this line of work because you simply can't afford it." He says, "You know you can't have a family and do this, and if you do, you're kind of rolling the dice and hoping nobody gets sick." His wife stated, "By the time he got home, we were about $70,000 in debt." While he was away fighting fires, his wife refused medical care for several months while pregnant with her son to prevent building up medical bills. However, her son was born several weeks early and still she couldn't afford the bills. Firefighters find it harder to care for their families while facing depression and PTSD. Facing traumatic events, firefighters are prone to developing depression, PTSD, and other mental health disorders. In some cases, firefighters do not discuss it, but it's still a serious and common issue. A lot of times, firefighters will go onto scenes and they'll see a young child that has been killed in a car accident or a fire, and they're the ones who remove them from the car accident or fire. Firefighters witness death on the daily, whether it be their partner, who they've known for several years, or a child who they had never met, who never had a chance to live. According to the International Association of Firefighters website, 46.8% of firefighters had suicidal thoughts. 19.2% of firefighters made plans to commit suicide. 15.5% of firefighters made a suicidal attempt. These statistics show that firefighters are not receiving enough mental and emotional support. More often than not, firefighters are exposed to graphic scenes that contain the deceased, blood, and gore. This can cause firefighters to develop PTSD, with PTSD being underdiagnosed in the firefighter area and the numbers indirectly relating to suicides. More help must be given to prevent losing heroes. While firefighters are fighting fires, they are risking their lives and their mental health to save the common person. While being on the front lines, firefighters face many aspects that may be damaging to their immune system and cause them to lose sponsorship from a station. What I mean by lose sponsorship from a station is, as long as a firefighter is on a station, they are covered by health insurance. When they retire or several hours after they get out of work, they are not covered by workers' compensation or health insurance. Workers' compensation only covers firefighters 24 hours after they're off the clock, meaning 24 hours after they're done working. If they get hurt, they're not covered by health insurance. About 68% of firefighters develop cancer after they retire. While cancer developed from the exposure to toxic gases over many years after retirement is not covered from any form of health insurance. They do not have a system in place to care for firefighters that retire and move on in their life to do other things. This causes firefighters to go in debt while they're undergoing treatments for their illness acquired by helping innocent people, because they pay for their own treatments such as chemotherapy. As we see, firefighters endanger their lives and health, including mental and emotional health. With that being said, in order to provide proper service for the people, our firefighters must be given proper services as well. To ensure that our firefighters are being cared for, health insurance would be a beneficial service. Thank you, and good night.